Good afternoon, everybody. I'm Myra Ansari here for Wave Now's Ask the Doc. So we are talking about something that is impacting so many children across our country, and we're talking about obesity. And today, this is a big change, a big announcement today. For the first time in 15 years, there are new guidelines for treating children with obesity. The American Academy of Pediatrics published updated guidelines today in the Journal of Pediatrics. And the AAP says the goal is to help families make changes to a more sustainable lifestyle. Joining me now is Dr. Heather Felton with Norton Children's Medical Group to talk to us today about the announcement that the AAP has made. First of all, thank you so much for talking to us, Dr. Felton. In the patients that you see, the children, talk to me about how obesity, how much of a problem is it for children in our community?
It's a really common problem that we see often, aging from small toddlers, but all the way through adolescence. But this is a common problem that we see in a lot of our kids.
And, the obvious is, okay, it must be diet, it must be exercise, but there is more to obesity. It's also genetics, right?
There is a genetics component to it as well, and that's one of the newer things that we're finding and learning about this is that your body size and your shape may not be something that you have complete control over. And so what can we do to help patients to be as healthy as they can be?
So today's announcement, the AAP is not saying, okay, here's a pill, let's fix the problem. But we are seeing an increase in obesity over the years in children. I was reading the numbers, and they are very startling when you start to look at the numbers about how many cases we have. Let me see if I can find some of them in this article. For children with obesity, ages 6 and up, in some cases 2 to 5. The first approach obviously is to work with your pediatrician, but there are more options because we are seeing this as a chronic problem, especially after the pandemic, right?
Yes, I think the pandemic made things more difficult for a lot of families for a number of various reasons, whether it was activities that weren't available anymore or relying more on food as a form of entertainment or coping. But yes, it definitely seems to have been worse after the pandemic.
And I found the numbers I was looking for. According to the Academy, more than 14 million children and teens are considered obese. Dr. Felton, at what category do we look at someone and say, okay, you are dealing with obesity?
I think it's on a case by case basis, and it's something that you should talk to your doctor about because we have classically used something like the BMI to measure if a patient is considered overweight or obese or underweight. But it's not an accurate description for everybody. And so you want to take into account muscle mass, for example, because BMI just calculates your height versus your weight, but it doesn't take into account if that weight is due from muscle or fat, for example. It can also vary based on different racial and ethnic groups as well. And so it's not a perfect measurement of a person's health. So I think it's the overall big picture. It's something that you should talk to your doctor about. It's one of the reasons why it's really important to have a primary care doctor who sees you on a regular basis and knows about your lifestyle and is just making sure that your body is as healthy as it can be.
Dr. Felton, with the obvious of the physical with being obese, I'm trying to think of how to say this. Obviously, there's a physical component, but talk to me about the other things that happen to our bodies because of obesity, if that makes sense. And I apologize for not phrasing that question perfectly.
There are definitely comorbidities. There are side effects of being living at a higher weight, and so you can have high blood pressure. It can cause deconditioning, so where it makes it more difficult to exercise. You can have diabetes. You can have heart disease in the future. There are all kinds of things that can progress later on, high cholesterol. So these are all things that can build up over time, but it's going to be different for everybody. So not everybody is going to respond the same way or even in the same time frame. And again, it's just one of the reasons why it's really important to keep up to date with your regular well visits and your checkups to make sure that you're monitoring all of these things over the years.
So I want to go a little bit back to what the guidelines, that updated guidelines that came out today with the Journal of Pediatrics. This is also a focus on behavior therapy for children as young as 2. That means nutrition support and increased physical activity. For teens, that could also include medication and possibly even surgery. I think that component of this, Dr. Felton, now that we're introducing and talking about medication and surgery for teens, that is huge. And what's your take on that?
This is we're still in the very early stages of this. I think that it is important to not negate that healthy lifestyle, eating healthy foods and being active and getting exercise and good sleep. All of these things are important and are going to still be recommended. But what we've done over the years is just kind of watchful waiting. We're going to wait and see if this gets better. And what we have found over the years is that it doesn't always. And so if that's the case, then we want to have other options. Okay, well, what's the next step? We just don't want to keep waiting and continue waiting and not offering help, because what we find is that some children continue to become more obese and then they continue to have these other health problems that go along with it. And so what the AAP is recommending is to be more aggressive in their therapy that can really help with weight loss, and then also the management of these other possible side effects from obesity.
All right, I want to touch on something that you said, Dr. Felton, because this is also what the article that I was reading says, that, thinking that your child is just going to grow out of it. It's just baby fat. That is not always going to be the case. And that is why medical experts are so concerned about where we're at.
Right, exactly. And you have some patients who have really tried over the years to eat healthy foods and healthy portion sizes and increasing their activity, and they're not making as much progress as they would expect to be making. And what we are wanting to say is that it may not just be these things that you have control over on your own. What else can we offer to you to help in your weight loss goal, but also in your overall health goals, to make sure that you're not at risk for these other health problems in the future?
And you talked about some of those health issues. We were talking about diabetes, joint issues. The list is long. And that includes also the mental health toll that obesity can take on a person.
Yes, of course. And I think that's especially true for adolescents and teenagers. You see that a lot. And so, what we want to do is be able to um, make these recommendations of healthy lifestyle that are always going to be important, but then say, okay, what's the next step after that? We don't want to keep saying the same things and having the same conversations over and over again. We want to say, okay, well, we've done that, and now we did our best. What's the next step? What can we do after that?
According to what I'm reading, there are 4 drugs that are now approved for obesity treatment in adolescents starting at the age of 12. If I'm saying these incorrectly, please correct me, Dr. Felton. Orlistat, Saxenda, Osmia, and Wegovy, and one more, Phenermin, for teens ages 16 and older. Do you know what some of these medications, these drugs, do to help children lose weight?
And so some of them can help to block the absorption of fats. Some help with your brain and your stomach communicating with each other so that you can sense fullness, so that they will know when it's time to stop eating. But it helps to augment your weight loss goals, so that you can be more successful.
And why do you think, Dr. Felton, that we are seeing more cases of obesity in children? It's the food we eat, the lack of exercise. I feel like when I was a kid, I don't know, maybe you feel like it, after school, we spent our days outside playing all day. For kids, life is a little different. I see it in my children. And then some people on our Facebook stream are saying, it's the parents, it's what they're feeding the children. We are dependent on fast foods and that sort of thing. In your opinion, why are we at this point?
That's where it gets to be so complicated, because it's multifactorial. It's not one thing. You can't say it's just parents. Yeah, I mean, it's family structure, it's our regular diet, it's activity, it's social media and phones and the pandemic and all of these things, but they all play a role in where we are today. You can't point to one thing and say that's the only thing. And if you could just fix that, it's all of these things and you take them all in together all at once. And it's one of the reasons why it can be such a complicated problem to treat because you're not going after one thing. And I may not know what it is for this patient that causes the problem. I need to look at all of these different factors. And so if we aren't successful in finding what it is, or we've got too many of these going on to be successful on their own, maybe this is something else that we can offer to help in their goals.
And I want to emphasize that the AAP, and I'm sure Dr. Felton, you agree with this too, that medication and surgery, they're not the first line of treatments, and they should be considered only in special circumstances when lifestyle changes proven effective or individual patients. Also, that that some of these lifestyle changes, they can be really hard to adopt, especially for overworked low-income families. Is that correct?
Absolutely. You've got a lot of things going on and it can be hard for anybody to change their lifestyle and their habits. And now we're talking about children too. So the therapies that we've talked about, they become approved at age 12 for medication and age 13 for surgery. And these aren't going to be recommended for children who you start having concerns at that age. These are probably going to be for children that you've been watching this go on for years already, and we've made efforts and we haven't gotten there yet. But now that they come of age, then we can offer kind of the next step in their therapy. But for children who, you see their weight kind of creeping up, that's not going to be our first go-to. We're going to say, okay, we want to remember to eat healthy, watch your portion sizes, watch your sugar intake, make sure you're getting exercise, make sure you're getting enough sleep. All of those things are still going to be true and are going to be preferable to medication or surgery. This is just when we've been working at these things for so long and we've not made any headway. Now we have a next step to go to.
And the surgery, is this the same type of surgery that adults kind of go through for children, or is it a different type of surgery? Do you know that?
It would probably be similar to a bariatric type surgery that they're talking about.
Okay. And just overall, Dr. Felton, your thoughts of this announcement today and where it puts us at. Is it just more of an eye-opening piece of this is where we're at?
I think so. I think it offers some hope because it can be frustrating when you've been working at something for so long and not making any progress. And you want to be able to say, like, okay, if that didn't work, then what's the next step? This is just the next step. And because this is so new, it's not going to be something that everybody feels comfortable with going to right away. There are some people already who are saying, I'm not really comfortable with this, prescribing this right now. What I think I would rather do is wait and see some other people and how they're using it first. Maybe look at some of the long-term side effects from it before they feel comfortable prescribing it. And so there are already people in the pediatrics world who are having and voicing those concerns. But if you have concerns about this for your child, the first step would always be to talk to your doctor about it.
Absolutely, absolutely. And I think that is the thing that we want folks to take away today. If your child is facing an obesity issue, not just a couple pounds picked up here and there, but this is obesity that they have been facing for quite some time, you do need to address it with your child's pediatrician to kind of prevent some of those long-term effects that could be developing in your child, because sometimes it just doesn't go away as they get taller or older. That's just, a misconception many folks have.
Yes, exactly. And so I think that having a good relationship and making sure that you're not missing well visits, those are really important. And so from the age of 3 all the way up through graduation, when they leave pediatrics and go over into the adult world, we recommend getting an annual well visit, and that's so important. A lot of people think they need to go in only when they need vaccines or a sports physical or something, but it's really important to make sure that your child is up to date on the well visit. And that's one of the ways that we can help prevent obesity from becoming unmanageable in the first place. If we can see it at the beginning and screen for it early, it's much easier to fix, and hopefully we won't get to the point where we need things like medication and surgery.
Absolutely. I want to give a quick shout out to one of our viewers right now. Jeffrey Bird said, great conversation and info for sure. Jeffrey, thank you so much for joining us here, and so, all the other folks. Dr. Felton, is there anything that I did not ask you specifically that you want our viewers to know about this announcement? And maybe if they're struggling with this with their child, what they should do?
I think that not become like knowing that your pediatrician is on your team and there to work with you and help you and find resources. And so, whatever that might be with lifestyle changes, offering advice, um, but that's going to be your first step. And know that we're here to work with you as a team, stay up to date. And we can do not just those well visits, but also more frequent follow ups if it's something that you're really serious with wanting to stay on top of. We're always there for help, guidance, and advice.
I just a I don't have parenting down by any means, but one thing I enjoy doing is walking, and I try to get my children ages 7 and 9 out walking with me on a regular basis, and having a dog kind of helped us do that. But how young is too young, or how do you start incorporating exercise in children? Obviously, hopefully they get a little bit at school, but sometimes you have to take it outside of that as well.
Yes, and walking is a great form of exercise for any age group. And so, encouraging, it's similar to adults. You're wanting to do um, a few minutes, at least 20 or 30 minutes every single day of some kind of activity. I don't recommend necessarily strength training in younger kids, so kids who haven't gone through puberty yet. If they are, I would recommend talking to your doctor about it first. But aerobic activity, where they are running around and burning off energy, yes, that's wonderful. They're going to sleep better at night too. So there's another plus. But walking is a great one. Going outside, but even when the weather is bad, or like during the pandemic when like things were closed, even turning on music and just having a dance party at home is great also.
That is also a great way. I know that the pandemic made things challenging for so many families. We really had to get creative for not only ourselves, but also our children. But I think today's development and what's came out from the AAP really sheds light on where we are at. And we all have to do better and encourage each other. So I'm glad that we're having this conversation, Dr. Felton. Thank you so much for your time, Dr. Felton. I'm going to put a little story together on this later for you all on Wave News at 3 and 5 o'clock. So hopefully you will tune in. Dr. Felton, thank you always for your time. Always a pleasure to talk to you.
Thank you. It's good to talk to you too.
All right. I'm Myra, and sorry for Wave Now. I hope you have a wonderful day.